live from Mackinac desk. Really excited to talk through what we have coming up for the next hour and a half or so, and to be able to share some more insights of what's happening in Lansing. So joining us today for the 1 o'clock session, we have Mr. Paul Miller of WPHM that will be leading us through the stories. We got Representative Greg VanWoerkom and Senator Kevin Hertel. We're going to be talking about health policy and where we're going in this state. So, Paul, I turn this over to you.
Well, gentlemen, there's so much happening in healthcare right now. We could probably spend all afternoon talking about it. Representative VanWoerkom, you're dealing in rural healthcare reform. Tell us a little bit more about that.
Yeah, so part of HR 1, and I apologize for the voice, you're getting sultry Greg today. There was a lot of changes related to the Medicaid budget, and a part of that was some dollars coming to the state on the rural health transformation component. And frankly, we were a little bit disappointed on how much money the state is going to be receiving compared to other states and how much of a rural area that we have. So hopefully we'll be able to put something together and approach the administration again about that. I think the DHHS plan that was submitted kind of fell a little flat on what the administration was looking for. So hopefully we can find some ways to improve those dollars, because this is going to be several years. This is a 10-year of about $150 million coming to the state, that you really got to set up the state in a position that you continue those dollars that'll be sustainable moving forward, because those dollars aren't going to keep coming from the feds. So how do we come up with a plan, put it in place, make sure we got a sustainable system for our rural health care and get the services that they need?
Kevin, any thoughts on how that would look?
I think we both have the same goal, making sure that our Medicaid system is sustainable, that our hospital system can deliver for the needs, not only in urban areas, but also in our rural areas. We all have to make sure we do that work. I'm concerned with some of the decisions that we've seen from the federal government that has made that more challenging here as a state level. We do have to work within the reality that we have, so knowing those cuts are coming, we should be doing everything we can, and I agree with the representative, to make sure we're bringing every dollar we can into this state to pay for the healthcare needs of people in every corner of Michigan. But it really has forced our state to make some really tough budget decisions and try to make sure we are doing all we can to deliver for the people that need that care. And frankly, I think it is hurting the health care of people all across the state of Michigan, the decisions that have been made at the federal level, not just on Medicaid, on the individual market and the exchange. We're seeing that cause more people to go without coverage today than at any time in our recent history here in the state. We've got to make sure people have access to health care, and the way you do that is make sure they have coverage.
One of the big issues facing small businesses is the cost of health insurance, and there's a survey out this week that says nearly half of all small business owners in Michigan fear that in the next couple of years they won't be able to afford to provide health insurance for their employees.
The rising rates are affecting everybody, and that's why I introduced legislation just recently in the Senate that will allow small businesses to come together, pool their employees, and spread that risk out. Allow them to lower those rates. We've seen it been done in other places, where if you can at least bring more people into the plan, spread the risk, you can start to drive down some of those rates for employers across our state, and that will benefit all of the employees within those businesses as well. And so it's hard in small business right now for a multitude of factors with rising costs, but healthcare is one of those costs that is making it very difficult. We should be doing what we can here at the state level to address some of that.
Yeah, I'm glad to hear the senator is introducing that. Republicans have tried to do associated health plans for decades. Back when I was working for Pete Hoekstra out in D.C., this is when Obamacare was happening. We were pitching associated health plans until we're blue in the face trying to make that as a part of it, because the more people you get into the pool, the more you spread the risk. That's one of the issues that we're having with Medicaid right now, not necessarily things coming from the feds, but it's a lot of the unhealthy people are on Medicaid, and it's the healthy people that are dropping the coverage. So when you don't have that spread, it just costs more for the state. So I work on the Medicaid behavioral health budget for DHHS. I'm the chair of that committee, and we keep on adjusting the numbers of how much we need for Medicaid. And one of the major components of that is that it's an unhealthier population that we're serving. So the more people we can get on insurance, the more healthier people you can get on insurance, that just spreads the risk and then lowers the cost for everyone.
Yeah, why now? This is the time for this, right?
And I think the point is we have to focus more on preventative care, right? We spend more on healthcare now than we've ever spent, and we have a sicker population in the state as well. We have to make sure we're getting people in earlier to get those things addressed, and that you do that through coverage, right? Through making sure people have Medicaid coverage or can have affordable coverage through the individual market, or their employer can provide coverage for them. But we have to have a marketplace that works, and rising rates are pricing people all across our state out of the market.
When we're talking about health, we're also talking about mental health too, aren't we?
Yeah, like I said, I have the Medicaid and behavioral health budget, and behavioral health has been an issue that we've been talking about for a long time at the state. And you're just not seeing, well, you're seeing some creative things, you're seeing some new programs, but the demand is just getting higher and higher, particularly after COVID. And it's also been something people are more willing to talk about, where it used to be very quiet. Yeah. People are going out and seeking help, which is a good thing. But we have some systems currently in place that date back to the 60s, and we're trying to build based off of that, and it's kind of getting a little muckier, right? Mm-hmm. That we need to start looking at how do we actually deliver a service, actually get people to the support and assistance that they need. And I think the system is kind of a little outdated right now. So I think it's kind of time to take a look, maybe take what other states are doing, what have you, and come up with something so that it's not about necessarily the adults and the people and the stakeholders that have long been in it, but how are we getting to the assistance that people are in crisis, they need the support, and have a way that follows them through that process, rather than just getting to that first appointment. Particularly addiction and recovery, that's a long process. And how do you put in a system that makes sure they're getting to their appointments, getting the service, getting the help that they need, and have the proper help and the proper clinicians that are working with them. So it's going to be one that, it's not going to be, a meeting on Mackinac here and all of a sudden everything's solved. This one's going to take several years to really get people engaged, be willing to have honest conversation about how to address mental health in the state of Michigan.
Yeah.
I think the representatives have done a lot of great work in this space. I think all of us are hearing from our constituents, especially young people that are dealing with so much today. And I think early intervention is really the key. The same thing on the physical health side of making sure that people have access to healthcare at an earlier stage so they can find preventative measures to take. We've done a lot of investment over the last few years in some of the highest level of need for people with mental health care here in the state. If you look at what other states have done, they have a lot of transitional, mid-level, or early interventions that work really well. So you help somebody before they get to that point. You will always need that highest level of need, but you need to make sure you have, whether it's somebody experiencing that high need, transition back into the community, or helping somebody before they get to that need, I think is the biggest thing right now. And there's no doubt that kids today are struggling with more than they did when I was a young person, when we were all younger. I mean,
we're still young.
But, they're just faced with a lot of challenges. There's a lot coming at them, and they need the tools to be able to deal with that. And we need to make sure we're providing the mental health supports for all of that to happen.
Yeah.
Yeah. When I first got elected, you're doing all your meetings with the superintendents of your schools, and everyone mentioned something about mental health and kids and mental health. And everyone had a different way of doing it. Some were reliant on a short-term grant, and now that grant was being let out. Some were dealing with the local clinic, local mental health, local FQHC. It was kind of spread out of how each school was doing it. Some did it just internally. And I think that just kind of has created issues that we don't have that streamlined process that helps smooth it out, helps kind of address it, particularly on the bureaucratic side as well. And a lot of times when you're talking about healthcare, it comes down to whether there is a code for it. Is there a way to bill for it? And when you're relying on just a grant for 2 years or 3 years, that money doesn't last, and then you're reshuffling and trying to address it and trying to get grant that may no longer exist anymore. So one of the key components, I think, when we're talking about child mental health and things like that, early intervention, absolutely. Adults that care about the child is a critical part, not only just in the mental health, but the trajectory of that child and their education. But sometimes it just comes down to the simplest: can you pay for it? Is it billable? Is how a lot of things in healthcare end up getting done. And we've got an issue right now as it relates to crisis stabilization units. This is those people that, usually the homeless community or addiction community or something that has happened in their lives, they need that 72 hours to be somewhere safe, that's safe for others, rather than the ER. And we're having issues with that billing code on some of this stuff, and now there's need for dollars for those crisis stabilization units, which I think are a key critical component now on that spectrum that you were talking about of care, that full length of care. So it's one that you're working with DHHS, but it's a big number, and the state isn't going to be as flush as it was in years prior. That how you find some funding and stable funding for it.
So can House Republicans and Senate Democrats come to an agreement on this as you craft a budget for the coming year?
We'll get into the negotiation room. They have priorities. We have priorities. I would say there's a lot of things that you find in common. Maybe that's been a theme. I think it is your theme.
Oh, it is.
It's some common ground. Obviously, it's not going to make the headlines, but when you get in that budget negotiation room, there's a lot of things that you end up agreeing on. But then when you get down to those final dollars of the budget, because Medicaid is taking a big portion of that you don't have those discretionary dollars, there's going to be some that I have a priority with. Senator Santana is the counterpart on the Senate side. She's got her priorities. I think we're all trying to row and we all want to help people and support people. We just have different ideas of the best approaches to it.
And I think if you look over the past few budget cycles, we've been able to find compromise and common ground, especially in the mental health space, to make sure we're investing both in the DHHS budget and in the school aid budget. We've invested over $900 million over the last few budget cycles directly in school safety and mental health, because that's showing up there. And one other thing that I think is really important that the representative mentioned is this is showing up at our hospitals as well, right? And it's not fair to ask them to deal with it, and it's not safe for the folks that are working in those facilities to deal with it. These crisis stabilization units are really important. When police officers in our community come across somebody who needs more help, we don't want them to go to a jail. That doesn't help anybody. In fact, in Macomb County, we've invested in a new facility, an intake facility at a jail that will assess somebody when they come in to see if they have a mental health condition or a drug addiction, to get them the help that they need. They're not just locked away in a cell. But when they end up staying in the hospital for months at a time with no real support, it's not good for the individual, right? And so we don't want folks to end up in an emergency room or in a jail cell. We want them to end up in a facility where they can actually get the help that they need. And that's going to take a lot of investment across the state, but it will put people in a much better place in the years to come.
Yeah, like I said at the start, there are some very creative things that are happening. There is communities and the state rising up to try and come up with solutions on this. But last couple of years, I think there was a significant amount put in to put the structures in place. Now it's the sustainability of it and making sure that there's some funding on the back end there. But there are some creative things. People are getting the models put together. Again, each one kind of has their own little take, but each community is different too. That what may work for one doesn't work for the other. But it's still something that's going to take a heavy lift yet here in Lansing.
Representative, Senator, thanks so much. Appreciate it.
Thank you.
Paul.